This is my 10-minute mock classroom video. For the next portion of class, we're going to dive into the stages of labor. Before we begin, I would like to address expectations and what's normal. When talking about labor, you'll hear time frames like the seconds of a contraction, the minutes of a phase, or the hours of a stage. The range of what's normal for labor varies greatly and depends on a number of factors. Is this your first, second, or third birth? What position is the baby in? And how big is it? What position and movements are you doing during labor? All of these things and more affect the time frame in which these things happen. Some labors are 4 hours and some are 48 hours. The pushing stage can be 5 minutes or 2 hours. All of this is considered normal. So when we talk about time frames, I wouldn't automatically assume that you're going to be the fastest or the slowest of the ranges. While labor does have a semi-predictable pattern, your birth team won't be able to answer questions like how much longer or how many more contractions. The important thing is to be patient with yourself, with your body, and with your baby. Also, you need that felt safety to communicate your concerns with your birth team. The first stage of labor is divided into 3 parts: early labor, active labor, and transition. So first we'll discuss early labor. Early labor can last 12 hours or more. Some women experience prodromal labor, which can start and stop for several days. The cervix dilates from 0 centimeters to 6 centimeters during this phase. Early labor used to be defined as a dilation of 0 to 4 centimeters, so providers may differ on their opinions of this. Contractions are about 30 to 60 seconds long and happen every 5 to 20 minutes. Contractions may feel like tightening, backaches, and menstrual-like cramps. They slowly rise in intensity, and usually women can go about their normal activities. It's best to rest, eat, and drink as needed. Relaxation, distraction, laughter, massage, and walking are all good during this time. Many women make the mistake of going to the hospital in early labor. In some facilities, you will be on a 24-hour clock once you're admitted. OBs may want your labor to be making a lot of progress and suggest augmentation with Pitocin or breaking your water, instead of allowing your body the time to do what it needs to do. Next comes active labor. Active labor can last 6 hours or more and sometimes significantly less. During this time, the cervix dilates from 6 centimeters to 8 centimeters. Contractions last about 45 to 60 seconds and are 2 to 4 minutes apart. They continue to build in intensity and tightness, and you may feel more pressure. For some women, labor is a gradual, slow build, while others experience intensity out of nowhere. Relaxation, massage, distraction, and walking can help some, but more extensive comfort measures like counter pressure, double hip squeeze, hot and cold therapy, and hydrotherapy may be more helpful. It is important to remember to keep hydrated and empty the bladder frequently. Staying upright and active is great during this stage. Now we're going to watch a short video about coping with contractions. This is called The Essence of Coping in Labor, featuring Penny Simkin. Okay, any questions or comments about the video? Okay, great. Next comes transition. Transition may only last a few minutes or an hour or 2. This is the most intense part of labor, but is also the shortest. During this time, the cervix dilates from 8 centimeters to 10 centimeters. The contractions last 60 to 90 seconds and happen every 1.5 minutes to 3 minutes. So there's not much time to rest and cope between them. Usually the intensity of contractions has peaked and will not get worse, but the frequency can make them feel as if they've gotten worse. This is the time when it's very common for women to become completely exhausted and feel as if they can't do it anymore. Vomiting is also common. Most women desire lots of comfort techniques during this time. Some require the take charge routine, where the support person takes charge of helping mom find a comfortable position and comfort techniques to cope. Other women draw inward and seem to shut off those around them. Birth affirmations and mantras can be very useful. Here are some examples. My body knows how to give birth. I am a strong and capable woman. I will relax into my contractions. I am making progress. I surrender to the power of my body and allow it to open. I breathe deeply and stay calm with every contraction. I release fear and embrace my inner strength. Okay, so let's take a few minutes to brainstorm affirmations or mantras with your partner. Try to come up with one that really speaks to you and your specific needs. And anyone that would like to share theirs afterwards is welcome to. Okay, would anyone like to share what they came up with? Okay, great. The second stage of labor is the pushing stage and the birth of the baby. This may last just a few minutes or 2 hours. Some providers will allow 3 to 4 hours for this stage if mom had an epidural and if mom and baby are doing well. Some women experience a resting stage with a pause of up to 30 minutes between transition and the urge to push. As long as mom and baby are okay, there is generally not a reason to rush or augment this phase. Just because mom is dilated to 10 centimeters does not always mean mom and baby are immediately ready for pushing. During the second stage of labor, contractions are 45 to 90 seconds long, and they may be spaced out to 3 to 5 minutes apart. Some women find these contractions less intense, while others feel the sensation of baby descending and rotating as very intense. Some women experience involuntary pushing, known as the fetal ejection reflex. For many, pushing is very hard work, but some women feel a great relief being able to do something with their contractions. Encouragement and reassurance are very helpful during this time. An upright birthing position may be more comfortable and allows gravity to do some of the work. After the birth of the baby, the best place for it to go is mom's chest. The third stage of labor is the expulsion of the placenta. This takes place 5 to 15 minutes after the birth of the baby. If 20 to 30 minutes have passed, medical intervention may be necessary. This stage is usually less noticed by mom. It may be uncomfortable, but moms are easily distracted by the joy of holding their baby. Immediate skin to skin helps to release oxytocin, which aids in expelling the placenta. Some facilities routinely give a shot of Pitocin as part of active management to reduce the risk of postpartum hemorrhage. Fundal massage may be done before, during, and after this stage, and most find it uncomfortable. Okay, there was a lot of information there. Do you have any questions about anything I went over? Okay. Given what we've just learned, how does reality differ from childbirth in TV and movies? Okay, now we are going to discuss hormones in labor. Oxytocin is the feel-good hormone. It's released when someone feels safe, cared about, loved, and experiences massage or sexual touch. Fear and adrenaline interfere with its release. It causes uterine contractions, aids in bonding, provides natural euphoria, and in postpartum it triggers the letdown reflex for breastfeeding. Can you think of something that a partner can do to encourage the natural release of oxytocin? So everyone was given a handout, an oxytocin handout. I'm going to go over this just for more detail. Some of this will be repetitive, but It's that important. It's okay to say it twice. Oxytocin is a hormone secreted from the pituitary gland. It affects the social emotional processes in the body. Oxytocin is responsible for contracting the uterus to begin labor and creating stronger contractions as labor continues. It aids in reducing stress and pain and encourages attachment and bonding. It also helps expel the placenta after birth and with the initiation of breastfeeding. What encourages it? Many things help with the natural flow of oxytocin. A calm, peaceful environment with dim lights and soft music. Positive touch like slow dancing, cuddling, kissing, massage, or nipple stimulation. A support person who is focused on your physical and emotional needs. Reducing stressors and staying calm and relaxed. Limiting distractions and unwanted visitors. Bringing comfort items from home. Felt safety and laughter. And meditation and breath work. Okay, so what interferes with oxytocin? Feeling out of control, bright lights and loud sounds, a hectic or stressful environment, an unwanted or stressed person in the room, anxiety and fear, and lastly, epidurals and Pitocin. So keep that for reference. Next, we're going to discuss melatonin. Melatonin works synergistically with oxytocin. It's related to sleep, and it boosts the release of oxytocin in dark and quiet places. It's inhibited by bright lights and noise. Endorphins are nature's pain relief that is released during labor. The release is triggered with massage, gentle loving touch, and laughter. It also has a cumulative effect that builds. If medical pain relief is given and then removed, the endorphins may not have time to catch up. Adrenaline is the fight or flight hormone that is released in stressful or threatening situations. It blocks the release of oxytocin, can stall labor, increases heart rate, and can be triggered by bright lights, unfamiliar faces, stressful questions, and startling during contractions. Right before birth, this release can be normal and is one of the reasons mom and baby are typically alert right after birth. So thinking about these things, what can a partner do to protect mom from adrenaline rushes during labor? Okay, great. So our environment has a huge impact on our hormones. As you can see, understanding that oxytocin triggers and maintains contractions and that adrenaline interferes can help parents understand how different things can interfere with labor's progress. It also gives them ideas of how to encourage labor to progress. This can aid in the decision-making process of when to go to the hospital or birthing center, what family members to have present, if they want the lights dimmed or an IV placed, or interventions that require restricted movement. So the environment is important because it affects the hormones, and the hormones affect the labor. Does anyone have any questions about hormones? Okay, we will now watch a birth video and discuss any questions or comments afterward.